let's do a parathyroid deep dive. Let's talk about hypoparathyroidism. So what is hypoparathyroidism? Well, generally speaking, there are some causes of hypoparathyroidism that we call idiopathic, which basically means there's not a real understanding for it, and it usually is probably some sort of autoimmune disease process which causes hypoparathyroidism. But the more common cause of hypoparathyroidism is a surgical intervention in the neck region, which resulted in the parathyroid glands being taken out or being disrupted. And so as a result of that, the parathyroid glands no longer work, and the result is low calcium. And so these conditions are usually treated with calcium and vitamin D, and for the most part are treated relatively well. But there are some situations where it's difficult to get the patient's calcium and vitamin D into a normal range. And calcium, as you know, is important for bone, it's important for electrical impulses within the heart. There's a number of different things that calcium is important for, but the bottom line is that when there's hypoparathyroidism, it's oftentimes difficult to maintain those levels. And then it's also difficult because if you give too much calcium in those settings, people can have kidney stones, which is a consequence of the increased amount of calcium that they're taking. So what do you do? There's a new treatment that's been out for about a year and a half. It's called Yorvipath, and it's a parathyroid hormone-like substance that will increase the calcium, will allow people to not have to take calcium, in some cases, and vitamin D after this medication is given. It's an injectable medication, and it's taken on a daily basis, and it's something that can really change someone's life if they're able to get this medication that is currently available. So it's a new treatment. It's one that has been tried before with other medications like it, but they were not as successful, and unfortunately one of them was taken off the market. But currently this is our available treatment other than calcium and vitamin D. So it might be worth a try if you're in a situation where you have calcium and vitamin D levels that are unable to be increased with the traditional treatment. This might be a way to counteract that. So the other side of this coin is hyperparathyroidism. And hyperparathyroidism comes in a couple of different forms, but we're going to talk today about primary hyperparathyroidism, which is where one or more than one of the parathyroid glands in the neck are enlarged. Para means around, so it's around the thyroid, but it's not related to the thyroid specifically in any particular form, because parathyroid is associated with calcium metabolism, and it's important to maintain the calcium in the body. And so endocrinologists deal with hyperparathyroidism a lot. It's a common disease, at least in our world. So how do you treat hyperparathyroidism? Well, there's a traditional way, if it needs to be treated, is a surgical removal of one or more of the parathyroid glands. But at a recent meeting that I went to, the NASIT meeting in Portland in the last few days, there was a lot of discussion about the use of ablative techniques with hyperparathyroidism, particularly the use of radiofrequency ablation. And there was a lot of discussion about whether or not it was an appropriate treatment, what the complications of it are, and what the success is associated with it. The issues are related really to the size and the location of these parathyroid glands. They tend to be quite small, and they tend to be in a location which has a lot of other structures, nerves and vessels, which are in the neck. And as a result, there could be a potential risk of complications. So you really have to have someone who's experienced and has done a number of these procedures in order to get a good result. So it was an interesting conversation. There was several physicians and surgeons who felt like hyperparathyroidism should be treated in the traditional way with surgery, and others who felt this treatment with radiofrequency ablation should be given an opportunity to have a try. I think it's something that needs to obviously always be individualized for the individual patient, and something that would be consideration but needed to be talked to with an excellent proceduralist who has a lot of experience doing this kind of procedure. So the value of these meetings that we go to, the value of this particular one, NASIT, is that physicians can learn the science, can learn the techniques, and can discuss what are the appropriate ways to approach different problems in medicine. And these debates are how we learn what is the best way to go forward. So just like every field, medicine is always evolving, and there's always new things that we need to learn about and then decide what is the best for our individual patient.